Today we're going to be doing a fluoride varnish. You want to start by explaining to your patient what the fluoride varnish is for. So I would start by explaining that fluoride is used to help prevent dental caries or cavities, and typically you would want to use this either maybe on a child who is not so great at brushing their teeth or someone who seems to have repetitive caries consistently. So for a varnish, you'll need gauze, the brush, and the fluoride varnish. Once you have all that you need, you're going to want to go ahead and dry all of the teeth surfaces. Once the teeth are dry, you're going to ask the patient to keep their mouth open so that none of the surfaces get wet. After that, you would open your varnish, put your brush in, and mix your varnish really well. Then you're going to take your brush and apply the varnish to all of the facial surfaces of the mandibular teeth. Then you're going to go back and do the same for the occlusal surfaces of all the mandibular teeth, as well as the lingual. You want to make sure to apply a thin line so that it's not clumpy. And then go back and do the same for all the maxillary teeth. You typically would have a mirror for this, but I didn't have enough hands to hold a mirror. If your patient had recession, you would also want to make sure to get the varnish on all the areas of recession. Once you've applied the varnish to all surfaces of the teeth, you want to go ahead and talk to your patient and let them know that a film on their teeth is natural to feel. If you used a clear varnish, it shouldn't be visible. You also want to advise them not to eat any hard foods or drink any hot liquids for the rest of the day. Try to stick to soft foods and not to brush or floss for the next 2 hours. If they follow these directions, the effects of the fluoride varnish could last for up to 6 months.